afternoon, everyone. My name is PANITA SATITTOMMARONG, and today I want to talk about a problem that affects millions of people in Thailand: medication adherence among elderly patients with type 2 diabetes. Imagine this: an elderly patient forgets to take their insulin dose just 2 or 3 times a week. Over time, this can lead to serious complications, hospital visits, higher costs, and even long-term disabilities. Unfortunately, this is the reality for many patients today. But what if the solution could be as simple as a reminder on an app that they already use every day? In Thailand, type 2 diabetes is one of the most common chronic diseases, and elderly patients are the most affected group. Research shows that medication non-adherence rates among elderly patients can reach 30 to 50%. The reasons are many: memory decline, complicated drug schedules, and lack of caregiver support. When patients skip doses, it leads to poor blood sugar control, frequent hospitalizations, and even increased mortality. At the same time, we already know that elderlies in Thailand are familiar with Line. It's the country's most widely used messaging app, and many use it to communicate with family and friends. This gives us a unique opportunity to bring healthcare support into a platform patients already trust and use daily. My project is guided by 4 main objectives. First is to develop a Line OA account reminder system tailored for elderly diabetic patients. Second, to improve medication adherence rates compared to standard care, while also evaluating patient satisfaction and usability. Third is to promote a scalable, low-cost, and user-friendly tool that can support long-term health management. And finally, is to explore the potential of Line OA as a scalable digital solution that could be applied across Thailand. To achieve these objectives, I propose to enhance the existing Line OA account platform by adding features specifically designed for elderly patients with type 2 diabetes. The features include digital reminders for medication times, caregiver notification when doses are missed, check-in buttons for patients to confirm they've taken the medicine, and a simple dashboard that allows healthcare providers to monitor adherence. By building online a familiar platform, we avoid the steep learning curve of a new app. This means that patients are more likely to actually use it, caregivers can feel assured, and providers gain reliable data. So, the innovation here lies not in creating a brand new app, but in leveraging an existing, widely used platform in a new way for healthcare. The expected impacts are clear: improved medication rates, improved medication adherence, fewer complications, reduced hospital visits, and ultimately lower healthcare costs. Of course, there are challenges as well, because not every elderly patient is tech savvy, so training and caregiver involvement are essentials. Data privacy is also very critical, so strong security measures must be in place. And finally, healthcare providers must be willing to integrate this system into their workflow. But despite these challenges, I believe that the potential benefits are too significant to ignore. In this practice, this system can be rolled out in several phases. First is a pilot program with a small group of elderly patients and caregivers to test usability and satisfaction. Second is to expand to local hospitals and diabetes clinic, integrating with their follow-up care. Third is working with public health agencies to scale this into a national program. Beyond diabetes, this approach could also be applied to other chronic conditions like hypertension and heart diseases, making Line OA a versatile digital health tool for Thailand. So in conclusion, this project is about more than just reminders. It's about empowering elderly patients to take control of their health, reducing the burdens on caregivers, and giving providers a simple yet powerful tool to improve outcomes. Looking ahead, this approach could serve as a model for digital health innovation in Thailand, a low-cost, scalable, and user-friendly way to support chronic diseases management nationwide. With Line OA as the foundation, we can transform a familiar chat app into a healthcare partner, helping patients stay healthier, longer, and with greater independence. Thank you.
네, 질문이 있으신? 네. presentation. I'd like to ask you one thing about the topics. Why did you pick up a disease as a type 2 diabetes? There are many kinds of chronic disease.
It's personally because type 2 diabetes is a disease that is present on my father's side of the family. So it is passed down from generation to generation. So it is possible for me or my future kids or my grandkids to actually develop it too. So I wanted to tackle this personally from like experience-wise.
So can you expand these conclusions to other chronic disease such as hypertension or hypercholesterolemia?
Yes, I think because I only researched diabetes side, but I also think that if it is similar and if we adjust a little bit, it could also be used for other chronic diseases too.
Okay, thank you.
Thank you for your interesting topic. Do you think the elderly patients can access and use this messaging line-based messaging system easily, or do they still need some assistance from their family or other like helpers?
Because Line is already an app that is used very long time in Thailand, I believe that most elderly patients, in my experience, already have the app on their phone and already have experience using it too. But if they do need help using it, then volunteers and caregiver supports are also essential.
Do you think the elderly people also can, do they have really no problem in messaging their like conditions? I mean, the literacy rate in Thailand, can you tell me about that?
I think it's about if elderly people could use the app themselves, right, for medication adherence. I believe that they could use it themselves, but I also think that having someone to use it to help them guide through it is also better, because I do believe that in Thailand, elderly patients are not left alone at home, because some homes, they do have their kids with them, or they are taken into nursing homes where they do have support around them. So I think that the people around them or the environment can help them achieve the goal or help them guide through the app.
One quick question. So I think a line is like a person-to-person communication. So like the patients is elderly people, the healthcare provider, who's going to be in charge of checking this message from the patients? I don't think a doctor or nurse, do they have enough time to do this, or what?
At first, I planned it to only put it into clinics first, so just like a small pilot clinic to actually help them, because the first phase is pilot study, which is just to put it out as like a tester for a specific selected group of people, and with that, then there are professionals and volunteers to help them check the data that they received.
네, 질문이 없는 걸로 알고